Happy Friday, everybody. Welcome to everybody's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode,
Friday, everybody.
First off, fat grafting for breast augmentation. Is it a good idea? Sometimes it is. I'm going to go over with it and also some other reasons for fat grafting. And then Ariana Grande, weight loss, Ozempic rumors. Wow, this is kind of a crazy one. We're going to break it down. And then finally, there's a new article out there, warning of cosmetic surgeons. I've been talking about this forever, and now the media's taking note. It's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like, subscribe button, turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me is Sarah.
Howdy.
Hi, Sarah. Everything good? Are we good? We lost the camera. Oh, we're still good? Oh, okay. I was like, did we go?
Yeah,
did
technical difficulties.
How are you, Sarah? You doing good?
I'm good.
Brennan, how are you in there?
Doing good. Getting used to this new setup.
Yeah, the new system. We're in a new studio today.
Yes.
Yeah, it's awesome. Like new building and everything.
Yes.
It's very beautiful. I can't wait to kind of see when we get back to the talk show one. That'll be awesome.
Yeah,
So-
that one's great. It's bigger. We can fit more people. So if we get
Like all our fans.
right, yeah, a big live
There'll be
audience.
people lining up. We'll get there one day.
Yeah.
All right, well, let's jump into segments since we had to do a second time around here. All right, so this first segment actually comes from something that I was doing in surgery the other day, which is sometimes I'll see things and be like, oh, this would be a great segment. It's a topic I kind of have a love-hate relationship about, and this is a segment about fat grafting for breast augmentation and also some of the other reasons people do fat grafting. And you guys have heard of fat grafting, right? We talked about this. You're familiar? Okay, so for those who are not in the know, fat grafting is when you harvest fat with liposuction, and then instead of throwing the fat away, which is what's been done for decades, you actually use the fat to augment another area. And there is one surgery we talk about all the time that is fat grafting. You know, guys, I hate it.
Yeah.
The butt lift.
Yes.
Brazilian butt lifts. I hate them. We'll talk about that more in a minute. But that's kind of the one that everyone knows about. Although it's not as actually labeled as fat grafting, it is fat grafting. It's not a true lift in the sense of moving skin around. So this came out back when I was a plastic surgery fellow. So I've kind of been doing this since the very beginning. So, the big question is, does fat grafting work? And the answer is yes, but with a little bit of varying results. So if you look at the research papers on this topic, you'll see a range of fat grafting survival that goes from 20% to 80%, which is like a huge number, right? I mean, how do you know if you're going to be the 20 or the 80%?
Yeah.
And in the old days when we started doing this, we didn't really know like the best ways to kind of get that fat to stay, and that's when we had a little bit lower numbers. And we've kind of learned that the harvesting and the technique that you use to process this fat is pretty critical. Like in the old days, we used to pull that fat out, and literally it would be in these big like syringes, and we'd take a spoon and we put it through kind of a strainer to get the fluid out and rinse it, and then just stuff it into syringes. and then inject. Yeah, it was kind of crazy, right? And looking back now compared to how we do it these days, it's very archaic. But it's new technology. Nobody really knew. We kind of were learning as we go, which sounds scary, but sometimes that's how medicine is. So as far as what it's used for, initially we use fat grafting kind of exclusively for breast reconstruction patients. Mm-hmm. So like if a patient had a mastectomy and they got a reconstruction, but there were some spots that didn't, maybe look perfect, we could do fat grafting. And I did tons of this early on in my career, like 15 years ago. We were harvesting fat and then putting it in patients that had mastectomies. But like with everything, and we've talked about this with other things where something starts out as medical and then becomes cosmetic. Ozempic's another one, started out as a diabetic drug, and that's a medication, not a procedure. But but it happens with all sorts of things. People started wondering, okay, what can we do with fat to maybe, do something more aesthetic? And then Brazilian butt lift became a thing.
Right.
People also do the facial injections of fat, which we've talked about. And then the other one is breast augmentation.
Like instead of getting fillers, right?
Correct, yeah. So, the problem with filler, it's not a problem, but just a kind of point of fact of filler is that it's not permanent. Which I guess is good and bad, right? Because if you get filler and you don't like it, I mean, you can dissolve it, which I don't recommend doing for a few reasons, which we should probably do a segment on that at some point. But you can just wait it out.
Yeah.
And it'll go away. With the fat grafting, it's more permanent. But then again, if you don't like it.
Can you put fat in your lips to get big old lips too?
I have not seen people doing that. I would never do that. And specifically the face, like I don't do facial fat grafting. I don't think it's crazy to do it. So like Brazilian butt lift, I think is crazy. I don't think people should be doing it. I just like the risks are too high. I mean, if someone is really, really good at it, like a good, well-trained plastic surgeon, it's fairly safe. But there's just so many problems with it, and I'm going to talk about that when I talk about the downsides of fat grafting. So I really don't like Brazilian butt lifts, and I'm not alone. There's a lot of people won't say it, but a lot of plastic surgeons are really against it, and some like myself say it. With the face, I'm not as against it. I just won't do it because of some of the downsides of fat grafting, which I'm going to go into. For reconstruction, I think it's totally fine because it's just a little bit different bar than aesthetics. And I think for augmentation, it's actually good in certain circumstances. So going to the issues, I mean, we've talked about this a few times in different segments, but I'll just recap it. So probably one of the biggest issues with fat grafting is the reabsorption. Okay. When you inject fat, it doesn't all stay. And so you can maximize that by the way that you treat the fat. And I actually have a really cool video that I'm going to show at the end of here, which shows me processing the fat. But reabsorption is still a thing, and it's not always even. Like you can get asymmetries with the reabsorption if you're doing two sides, like two sides of the face or two breasts. And so that's one thing. Donor availability is also a thing. Think about the people that want to get augmentation in a certain area. They tend not to be heavy patients. And so one of the issues with fat grafting is if you do it properly and you process it, you only get a fraction of the fat that's usable that you pull out. It's usually around a third. So if I pull out 1,000, which is a ton, you're going to get 300 cc's. Well, think about somebody that wants a breast augmentation. If you want to go up a full cup size, you need about 200 cc's per side, roughly times 2, because you have 2 breasts, that's 400 cc's, which means if it's properly processed, you need like 1,200 cc's of fat.
Gosh.
A lot of the patients that want a breast augmentation don't have 1,200 cc's of fat to give. And so that's one of the issues. And when you start talking about things like butt augmentations or Brazilian butt lifts, the amount of fat you need is tremendously more, and then absolutely they don't have enough fat. Or what happens is the surgeon cuts corners, doesn't process it to get more volume, but then it doesn't stay. So there's a lot of issues with that.
So it sounds like it's like way more expensive than getting like a regular breast,
augmentation with implants. I wouldn't say it's more expensive because there is the cost of the implants themselves, which when you do fat grafting you don't have that.
But what if you don't have enough fat? Do you have to you have to purchase the fat from like somebody else, right?
No, you can't really do that. Although there is a new one. In fact, we just talked about one the other day, right? That off-the-shelf fat. Am I hallucinating?
I don't know. I don't remember.
Didn't
Maybe.
We talked about off-the-shelf fat. That's a new thing. So that technology is coming, but historically, no.
Okay.
Because it's the same thing as like donating
fat.
an organ, right? I mean, I can't just give you one of my organs. Although I would give you an organ, Sarah, if you needed one. But we have to be a match, right?
Yeah.
Like a
blood,
like a genetic match. Yeah, right. So with fat, it's the same thing. Although there's new technology coming out that's kind of getting around that. And I swear we did a segment on it. Did we not?
Sounds familiar.
Brennan, did we do a segment on off-the-shelf fat? We did, right?
It sounds familiar.
Yeah, okay, all right. I know it's been a few weeks since we've been here.
Yeah.
That's the problem. But yeah, that technology's coming. The other issue is the hardening of the fat. That can happen. It can make it feel firmer than it should. And then, of course, specific to Brazilian butt lift, there's the risk of the fat getting into the bloodstream, which is a fatal or deadly problem.
Yeah.
So downsides of fat grafting, they're there. So my thoughts on these different procedures. I've said I don't like Brazilian butt lift. That's a hard no for me. For face, I'm okay with it. Like I wouldn't beat someone up if they were doing it for a patient. I just won't do it myself because it's just a little bit too unpredictable.
Yeah.
I think though for breast it's fine. The reason I have a little bit different feeling about breast is because of the old saying of breasts are sisters, not twins. If you get a slight difference in the reabsorption and one breast is slightly off from the other, like that's super, super common. I think that's going to be less noticed than your face if you have one side of your face that was off, right? Also, the breasts do sometimes have like more fibrous component, which means they're a little bit harder. And so if the fat got a little bit hard, then I wouldn't, be as worried as if you had hard places in your face.
Yeah.
Right? So I don't think face is bad. I just don't like it. I don't love it and I won't do it. But for breast, it's okay. All right, so who do you do, right? Who's the patient that's going to get fat grafting in their breast? Well, we talked about the issue of like there is a problem if you want to go really big. Like if you want to go 2 cups up with fat grafting in your breast, it's not going to be possible. Like you're just not going to have enough fat to do that. So first off, who might get a breast augmentation with fat grafting is somebody who doesn't want a big augmentation. Like maybe a cup max per side, realistically more like half a cup. But there are those people out there, and every once in a while I'll get a patient in who is like maybe a large C and they want to be like a mid D, and I'm like, look, actually you can't do an implant for that because the smallest implant is around the amount that would make you a full cup size. So they're kind of the opposite problem.
Right.
Like it's hard to do a breast augmentation when somebody wants to go up a half cup size, and that's where fat grafting comes in. It's a perfect solution. So I just recently had a patient that came in that actually wanted to do a thigh lift. And as is very common with any skin contouring, whether it be a thigh lift, arm lift, tummy tuck, we oftentimes have to do liposuction.
Yeah.
And she asked, can I use this fat to potentially augment my breasts? And I was like, yes, you can, but you're probably only going to have enough for like a third to a half of a cup based on what I saw there. And she's like, that's fine. That's all I want. Okay. And I was like, okay. And so we did it, and man, I have to tell you, and I don't have befores and afters of her because she's still very early, but it turned out really, really nice. Like it looked great. And again, we got to see how everything sorts out. But like right off the bat, man, it just looked amazing. I was so happy with it. But I did do some video in the OR of how the fat is processed. Yeah, it's like in an OR video. I thought it would be cool to kind of see that. So when you do this video, Brenda, will you leave my mic on so I can talk? Because there's no audio for it. All right, roll it up. Okay, so this is the machine that I use to harvest the fat. And I want you to notice what the color and consistency of that is. It's kind of like reddish yellow. And what I'm doing is I'm cleaning it and processing it. And I do that multiple times. And this is after the fat has been sucked out of the patient and it's in this little machine. So this is a Revolve fat grafting system. It's made by LifeCell. I've been using it for like a decade. And I absolutely love it because the fat that you get out of it is absolutely perfect for grafting. So good. I just love this machine. I'm giving LifeCell a heads up.
It looks like plasma to me.
So wait until you see it after I've finished processing it, okay? All right, now look at it.
Wow.
Look how yellow it is. And now I'm about to start drawing it out. Is it going in slow motion or am I hallucinating?
Yeah, it's a little slow motion.
Did I slow motion the video? Is that how it is?
That's how I downloaded it.
Oh, really? Okay, well, it'll be fine. It's not a long video. It'll give me time to talk. So what I'm doing now is I've processed this thing entirely. You can see how different the fat looks. It looks nice and bright yellow. It's almost like a slurry. And you're gonna see I'm gonna start pulling it out into big syringes. And look how easy it comes out. Sometimes I do have to go back and forth just because you'll get like maybe a little bit of fibrous in there. And so I'm kind of going back and forth. Also, this video is a little slowed. So in reality, I'm moving a little bit quicker than this snail's pace. But look how beautiful that fat is. I mean, it's just perfect. It doesn't look like big chunks. There's not any blood in it. There's no like excess liquid. Like the stuff is coming out perfectly. And this is when you get like that really, really awesome takes. Why did the video go backwards? Did we go backwards? Did it?
Not sure.
How long is the video say it's supposed to be?
It says 1 minute.
Oh, here we go. All right.
Interesting.
So yeah, something really happened there.
It's hot around
Okay,
here.
so I've then since transferred that fat into smaller syringes just with like a transfer connector. Those are all my vials that I'm going to use to actually inject, and hopefully the last part didn't get cut off. Yep. So this is the actual
Put those big old
Coleman
needles in there.
So it's not a needle, it's blunt. It looks like a
Okay.
needle, but it's not sharp. So what you do is you make a very, very tiny incision, like a millimeter or two, and then the fat will go right through there, and you can almost see that one hole that's right there where the fat comes out. So yeah, that's beautiful fat, man. I look at that, I'm like, man, that is what it's supposed to look like.
And all those syringes came from just that one.
So I got 17 syringes.
Wow.
That's processed, 17 processed syringes from that patient.
And that patient got like...
So I did 90 on one side and 80 on the other. So that's like the equivalent of just under half a cup increase in size, which for her was all she wanted. It was perfect. And I have to tell you, it looked phenomenal. When she gets further out, I hate to do befores and afters on the show because I don't like the show to be like an advertisement for me. It's more about education. I may break my own rule on this one because it did look really nice.
I'll forgive you.
You'll forgive me?
Yeah.
Okay. It did look good. So I do think that, that breast augmentation, fat grafting is a thing. It's just for a specific group of people. So.
Right.
All right, let me recap this one real quick, Brenna. Fat grafting for breast augmentation, is this a thing? Yes, it is. And I actually do this. I'm not a huge fan of fat grafting because I don't like Brazilian butt lifts. I've talked about this so many times. They are dangerous. I'm not a huge fan of fat grafting in the face, but I think it's a little bit more reasonable. But for the breast, I actually really like it. Now, the one thing you have to remember about fat grafting for the breast is it is actually pretty hard to get a big augmentation because when you harvest fat to inject it into another area, it has to be processed if you want the fat to survive. And that means if you pull out, say, 1,000 cc's of fat, which is a huge amount, you're only going to get about 300 to 350 cc's of usable fat, which you then have to divide by 2 breasts. Also, people that oftentimes want breast augmentations don't have that much fat to give. But for the patient that wants to go up 1/4 of a cup, 1/2 a cup, and believe me, there are patients out there, there are people who are large C that want to be like a small to mid D, and an implant's not the right answer. Fat grafting actually is a pretty good way to do it. So if you want to see more, check out the full segment. Okay, moving on. Are you guys Ariana Grande fans?
Yes,
Yeah.
I just saw Wicked yesterday, so I saw that.
The new one?
Uh-huh. Part
the
2.
Wicked Forever.
Yes.
I actually
Wicked
wrote-
for
Were
good.
you about to say Batman Forever?
No, I was not going to say
Wicked for
Batman.
good.
Wicked for good.
And
Did
it
you
was
guys,
good.
Was
I
it good?
liked it. Yeah,
I've heard mixed reviews. I haven't seen it.
Some of it was a little cheesy to me.
Was it?
Yeah, like there's this part where
Well,
I don't
it's
want to
a
spoil it, but they
musical,
It's a lot of
there's like
singing.
a slap to the face, and the cut was not very seamless in my
you were giving the thumbs
editing
down.
opinion.
I know, you're like the right person to ask about that with all
Yeah.
the editing and stuff. Yeah. Well, did you guys see the other news about Ariana Grande this week?
Yeah.
She's just super skinny.
Yeah.
I've also seen a lot of like
Social
stuff of
media
her
stuff.
acting weird with Cynthia. Like
I've
they're
seen
always
that
so
too.
touchy and
Yeah. Are they like
it's
an item or
weird.
no?
Are they what?
Are they like an item? She's married. I thought Ariana Grande was married, right?
I don't know. I don't think she is.
I know, I'm
She
not a
was
huge
married
Ariana
at
Grande
one
Yeah.
fan. So, well, you guys have seen what this segment's going to be about. 32-year-old Ariana Grande has been in the news because her fans have been concerned about her appearance. And this started a rumor mill of her because she is so thin that she might be using Ozempic. And that's what caught my eye is an article that talked about Ariana Grande's weight loss and is it Ozempic? So I kind of looked into this because when I heard that Ariana Grande might be taking Ozempic, I was like, what in the world? Why would she take Ozempic? Like
Yeah, she's like the
she's like
size of my
small to begin with,
pinky.
right? So I didn't really believe that, and then I was like, okay, I got to start pulling up some pics. And man, I tell you, I started pulling up pics, and I thought they were fake.
She looks like a skeleton.
I thought they were fake.
Yeah.
Yeah.
But apparently they're not because they're on multiple news sites. So throw up the first 3 pics, Brenna. Wow, like
It's crazy.
I thought that was a fake photo. I thought it was AI, and then I kept. Yeah,
And when you see videos of her too, you can really tell.
yeah. So go to the next one. Like, yeah,
Oh my
she
goodness.
is just so thin.
Her what is that?
It looks like she
What-
took
but
out her breast
not
implants
ribs,
too. By
her
the way.
collarbones
Yeah,
and-
collarbone.
She had
well, that is
breast
her. That's her
implants?
sternum right there.
Sternum, thank you. Yeah.
sternum and her wrist.
She
coming
had
up.
breast implants?
I think so on that left picture. It looks like she
Oh
has.
my
I
breast.
don't
goodness.
I don't think
Not
she
anymore,
had-
at least.
I don't think she had them. I think her body just used all of her fat.
So okay, so looking at that left picture,
You think she
either
had a
she has breast implants or she's got an amazing push-up bra. Because look at the curve, right? Remember we talk about how you
Okay.
tell someone's got implants? If they got a good curve at the top of the breast, that's implants. All right. Now, it could be a really good push-up bra that's forcing that up, which would make the breast have an opposite teardrop shape, where it was round at the top and slanted at the bottom. But I just took a first glance. I was like,
she
she's
might
got
be
implants.
wearing a corset dress.
Yeah, it could be.
Like
It could be a push-up. I don't know. I've never looked into whether or not she's had it. I just looked at that. I was like, she looks like she has implants, but it could be a really good push-up. All right, go to the next one. So I didn't believe this, so I had to go to her Instagram where it's like the real photos of her, and then I pulled these two off her Insta, which, yeah, I mean, she is like, whoa,
Gross.
she is really, really, really thin. Yeah, she's had this crazy amount of weight loss, and, could it be Ozempic? I mean, it's possible. I mean, it's definitely unconfirmed.
You can get it. I said you can get it. I get advertised for it.
Oh, totally
Not
you
just
can get it. Totally you can
on
get it.
Facebook, Instagram.
Everywhere.
It's like, get GLP-1s. You don't have to be, you can be a size 2 and still get it. And I'm
they
like,
say that?
Yes.
Oh my gosh, that's crazy.
They're like, you don't have to be overweight.
Well,
you can get it.
It's very possible she took Ozempic, but it's definitely not confirmed. She's not said she's taken Ozempic. There's no confirmation. I think it was just like news articles trying to drum up clicks or whatever. We've talked about Ozempic in the past a lot. For those who are not familiar, the GLP-1 drugs have been out for decades now. Initially used for diabetes, they found that they actually help people lose weight, and they work fantastic. You can lose weight very, very easily with these GLP-1s, and the side effects are actually very minimal. There's the very, very rare kind of more significant issue with them, mostly if the drugs are taken improperly. But if they're taken properly, they're fantastic drugs. They actually work by making you feel full faster, both by receptor and receptor agonist, meaning it makes the receptor start working, which makes you feel full. It also slows down your stomach emptying, which also makes you feel full. And these drugs work. About 40 million Americans, that's an insane number, have been using GLP-1s in the past year. And in people who are concerned about aesthetics, like in my practice, the number of people that come into GLP-1s is more like 30 to 40%. Like, it's enormous.
I have like 4 people in my family that take it.
Really?
Yeah.
Wow, that's crazy. The benefits of these drugs has been well established both for diabetics and obese people. It's just undeniable that these drugs are insanely beneficial for those who actually need them. But this segment, brings up the question of, well, what about the people who don't really need them? Is that safe? Is it ethical? I mean, we don't even know if she was taking them. I've heard some rumors that she has like eating disorder stuff going on, so maybe that's just that. I would hate that for her. I mean, whether she's taking Ozempic or that's all like not
I
necessarily
feel like
good.
it's a disorder either way.
It is like
Like,
it'd be
her
a body
goal is to-
dysmorphic disorder.
yeah.
Yeah, if she was taking Ozempic, because I mean, she looked phenomenal in that picture from
Yeah, she's never been
2
overweight.
years ago. Yeah, don't mind, not at all. So I don't know what's going on with her. I obviously wish her the best. And I mean, if she wants to be really skinny, I mean, that's her prerogative.
Yeah.
I'm not gonna, it's not what I personally would find, attractive. But I mean, if it's her body, she can do what she wants. I mean,
her co-star, I forget her name.
what's the
but-
co-star? Brittany, you just said it. What was her name?
Cynthia, I forget her last name.
She's also gotten extremely skinny
Yes.
since
They have, yeah.
filming that second one.
I
Like,
wonder if
she
they're-
went from being like looking like nice and like fit and
Yeah.
stuff
To like she's really skinny too. Yeah.
looking like Skeletor, like
Skeletor.
Ariana. It's
Yeah.
wild, and then
It's wild how
she
skinny
wears
is.
these really long fingernails, so she looks very like
Yeah, she always has long
like-
nails.
she looks like she's gonna like put a spell on.
Oh my god.
And green eyeshadow. She
Yeah.
always
Oh my
has
God.
some kind of green on her.
Well, so I wondered when I saw her, I was like, there was a really famous model back in the 90s. Sarah, you may remember hearing about her.
Your
Brenda-
favorite one?
Huh?
I think you always talk about her, Kate Moss.
Yeah, Kate Moss.
Yeah.
She wasn't my favorite, but I didn't dislike
She was
her.
the
but
most famous one.
she's
of
the
that.
most famous
The
skinny
crackhead
model.
era.
Right. Everyone was like, is Kate Moss on heroin? Because, heroin was
Yeah.
like so big in the 90s. And none of those heroin people look big. All right, throw up Kate Moss's picture there, Brennan. It's the last one in that segment. I don't know. I think Ariana's even skinnier because
She
I
is
can't see her
skinnier.
ribs.
Yeah,
over-
like her chest bones, whatever. That's
Yeah,
her
sternum,
ribs.
like her sternum. Yeah, sternum. The sternum's the breastbone that connects to the
Yeah.
ribs. Look at Kate smoking a cigarette. Class. Look at the dude behind her smoking a cigarette too. No wonder we were so skinny in the 90s. Everybody was smoking.
Curbing their appetite with some nicotine.
So I mean, I don't think that Kate is skinnier than Ariana. I think Ariana has got her beat. I mean,
Yeah.
Kate Moss just looks super skinny. She didn't look necessarily unwell. Like I kind of personally think Ariana looks a little unwell.
Like
and that,
her like in her arms, like her elbows look like
yeah,
like you can
yeah.
see the nooks.
You see that in
of her.
malnourished people,
Yeah.
like people that are like, you know, nursing home bound, that are just not eating anymore. Like
Or
you see
like
that
starving people.
Or,
in
yeah.
other
Ariana's neck
countries.
too.
Yeah.
That first photo, if y'all want to see it.
Like she
again.
looks
Yeah,
like
bring
she's
it
a
up.
starving child
That-
from
her
another
neck.
country.
Yeah, you can
I
see
noticed
all
that
her
in the
muscles.
movie,
Okay, look,
too,
you can
when
see
she's
her
singing.
sternocleidomastoid muscle, which is that line
Yeah.
kind of going up to the right. That looks like her jugular vein and carotid artery right there to the left of it that's making that V. I'm not 100% sure, but that's what it looks like, which would mean that she's got like zero fat in her neck. I don't know. It could just be like just the shadowing, but yeah, that doesn't look necessarily good.
Yeah,
And-
y'all need to watch the movie because you can really see
Really?
all of it.
When
and-
she's singing?
Yes.
Yeah. So there are some risks of being too skinny. Just, you know, for people out there who may be thin and thinking about taking GLP-1s, which I'm not a huge fan of. I mean, I'm not someone who judges people's choices about, hey, you want to be really skinny. But you should be aware that there are some issues when you kind of take that to the extreme. Immune system starts to go downhill pretty noticeably when you're really, really skinny. Malnutrition in general, where like you're not getting enough nutrients and then your organs start to have issue. Bone and muscle loss, which is always bad. Fatigue, and then if you're a woman, infertility and pregnancy complications.
Yeah, hormonal issues.
Yeah, you have
for
hormone issues if you
sure.
don't have enough fat. Right,
Yeah.
absolutely.
Cindy in the comments also said she would be concerned about some type of medical disorder like hypothyroidism.
Oh, yeah, that's smart.
And you got some birthday wishes.
Happy birthday to me. Oh, thank you. Thank you. Yeah, maybe, like hyperthyroidism, maybe, but I don't know, like I've learned one thing in medicine, and it's common things are common. If you hear hoofbeats, it's usually a horse, not a zebra, right? And so to me, like the more common issue would be, you know, using some sort of weight loss drug or like some sort of eating disorder. I mean, hyperthyroidism does happen, but normally when people have that, they're like, what in the world is going on with me? This is not right. And then they go and they figure
Get
that
their
out.
hormones. Yeah.
Yeah, they go and get it
everything
checked, right?
Yeah.
So, yeah, I don't know. I mean, no, who knows about the Ozempic? I do know that it's an issue. We get more and more people coming in our office that, you know, look normal to, I don't want to say skinny, but slightly smaller than normal. And they're like, yeah, I'm on, you know, Ozempic, or I just started taking Ozempic. I'm like, what? And they're like, well, I only want to lose 5 pounds. And I'm like, okay.
Yeah, and the other thing that I've been looking into is that Ozempic causes you to lose not only, you know, fat, but muscle.
Right.
And it's like very dangerous.
So
If
actually,
you like
there's some,
take it too far.
there's
if you're
a lot
not
of-
working out and stuff.
It is a problem if you go too far. There's a lot of research papers on that. We've talked about that a time or two ago when we talked about Ozempic.
Yeah.
One of the research papers I saw that talked about the issue with muscle loss, which is a thing. Anytime you lose weight, you're going to lose muscle. Period. Like that's not like an Ozempic thing. That's like I'm losing weight thing. But it did mention that it could be completely counteracted by just like small amounts of like resistance training. Like
Yeah.
if you're losing weight with Ozempic or GLP-1 and you want to counteract that muscle loss, which I think is a great idea, like just even resistance training, like working out a little bit, will counteract it. Yeah, there was a study on that, but it is an issue. And it's a good point to bring up. You know, that muscle loss is a huge issue. Yeah, so I don't know what to say about her. It's a little concerning how she looks because it almost looks like she is borderline unwell. And of
Yes.
course, you know, I mean, we want her to be well. I hate to think that, you know, she was coerced into doing this because of, you know, the expectation of celebrities and stuff. I mean, that makes me sad.
I don't know who she'd be comparing herself to.
I don't know.
I
Yeah,
don't think there's anybody that's
right.
taken that.
To that extreme.
Yeah.
Yeah, it's
She's
crazy.
like the first.
Yeah.
She's already very famous. I don't see.
I know, right? Yeah,
I don't
get it.
see them.
She looks so great too.
I don't see the wicked people being like,
Right.
yes,
Like,
you need to lose
yeah, you
weight.
need to lose weight.
Especially in 2025. I feel like this was a
Yeah,
thing
it's all about
a
body
while
positivity.
ago.
Although it is kind of like the pendulum's swinging back a little bit. Like, yeah. Okay, let me recap this one. Ariana Grande hitting the news this week. Man, crazy stuff. Of course, she's in the news because of her new sequel to Wicked. But her fans have been super concerned about her appearance lately because, wow, has she gotten really, really thin. I saw some pictures that were popping up on the internet, and I did not believe them. I thought that they were AI generated or faked, but they were not. They were actually her, and she has lost a ton of weight, which brings up the article that I saw that caught my eye is, was she using Ozempic? I mean, there's no confirmation of that whatsoever. She hasn't said that. No one's confirmed it. It was just speculation. Is it true? I mean, who knows? It's definitely a possibility. I really love Ozempic and the GLP-1 drugs. They are fantastic for both diabetics and people who are either obese or overweight. All the medical research shows that the benefits are enormous with very, very few downsides. But I have seen an increase in the number of people who are either normal or even slightly lower weight than normal that are seeking these drugs out to just maximize that skinny look. And yeah, is it possible that Ariana did this? I mean, it certainly is possible. Who knows? And of course, we're not beating up her. I mean, if she wants to be super thin, that's her prerogative. But there is the medical issues and medical concerns of if you get that skinny, is it bad for your health? The answer is yeah. Your immune system starts to go down. You lose muscle, you lose bone. If you're female, your hormones get out of whack. Like you can have pregnancy complications and infertility issues. So, I mean, there's just that concern with it. So yeah, pretty crazy. We'll kind of follow along and see what happens to her. So, okay, last segment. You guys ready?
Yeah.
All right, yes. I got a kind of a crazy story here. It's about a doctor. I've been talking about this forever. These fake plastic surgeons that call themselves cosmetic surgeons. You guys remember this, right? When I say cosmetic surgeon,
yes.
Like I say that negatively. That's a bad term.
Pretend.
Rarely does,
I said they're pretend.
Pretend, that's right, the pretenders. So rarely does the news bring this up, but there was a new article that came out just recently, an article warning about what it is to be a cosmetic surgeon. That's the guy that we're going to talk about right there. The article actually had a different kind of headline. It was more kind of going to this guy kind of messed up, and is that going to affect transgender people because people are going to jump on this guy and say, oh, this is what the gender transition surgeries result in. But when I actually read the article, it actually talked a lot about the fact that this guy is not a plastic surgeon. So this actually comes from Investigate West, which is I guess an investigative journal out on the Pacific Northwest. Throw up the article if anybody wants to see it. Again, the topic was more talking about, how is this going to be backlash for trans people? But when I was digging into it, there was a lot about this guy's training. So this is Dr. Jeffrey Stiller. I don't like this guy after reading this article. Now, this is what the article says. A lot of his allegations, none of this has come out. Some of it's come out in like court stuff, but a lot of this is just allegations.
What is he a doctor of?
Doctor of medicine. He's a doctor of medicine. Oh, you mean like what specialty is he? Yeah, great question. So he trained as a general surgeon. So he trained what I trained in, which is general surgery, which makes you really good at doing hernias and gallbladders and appendixes. But never in a million years after my general surgery training would I try to go and do plastic surgery because I have a conscience. But he had other plans. He did do a fellowship, and I'm going to put fellowships in quotes because when these people do these cosmetic fellowships, these are not recognized by the governing boards. And so what that means is there is plastic surgery fellowships, which are certified by the ACGME, which is the Accredited Council for Graduate Medical Education, which basically says this program is legit. The plastic surgery program has met all this criteria. It's of a certain length. It has you doing enough cases. It allows you to be eligible for a board certification that is recognized, and that's a real program. These guys that do, general surgery and then do these fake fellowships, you have no idea what they are. In fact, I have a really interesting kind of story about that. And you guys know I do legal consulting, and one of the cases I'm looking at now, for the plaintiff, is someone who claimed a fellowship just like this. They were not a plastic surgeon. And when I looked up the fellowship, it was a med spa. So they're claiming that they did a cosmetic surgery fellowship at a med spa. Like that makes zero, does that
That's
make
like where you get like Botox
yeah,
and laser
exactly.
stuff.
In fact, the place that I looked up didn't even list surgery as something they did.
Yeah.
Yet this guy was claiming a cosmetic fellowship, right?
Yeah.
And because the laws are so just unregulated in this, people can get away with it. Now, there are a couple states out there. I almost never give California the thumbs up on anything, but I will in this instance. California actually has made a law that said you cannot claim to be board certified unless it is an actual real board. So this guy is in Washington. He did this fellowship, which no one has any idea if it was legit or not. Most of the times they're not. Like it's basically people doing a money grab. Like it's me if I wanted to train someone and they pay me and they come and follow me for a month and they're not doing surgery. Like they're just watching. And
just like an internship.
And then you graduate from your fellowship. But there is a board that accepts those, which is the American Board of Cosmetic Surgery, which I hate them because they allow people like this who have not had proper training to get a board certification. But again, this board is not recognized. A hospital will not recognize the American Board of Cosmetic Surgery, nor will a surgery center. It's not recognized as legitimate. It's not recognized by the American Board of Medical Specialties. But then the person can put it on their website, and in Washington, you can do that. California, you cannot. You cannot claim it. So this guy started doing transition surgeries, also doing general plastic surgery, and this article, talked about like all the issues he's allegedly had. He was doing surgeries in his office. Why is he doing them in his office? You guys
can't go to a hospital.
Because he can't go to a hospital or surgery center. Bam, Sarah, you're so smart. Advertising himself as a board-certified cosmetic surgeon, started doing a lot of patients, but he started having a bunch of issues. Now, again, most of these are allegations except for the first one. He did get a DUI, blew like a .21 or something, which is bad. Generally, you lose your license for that, or at least have to go to remediation, which I think he did. But he's had a lot of issues, and these are alarming when you look at these. Again, accusations, allegations. Accusations of operating while drunk. That one's not good. He did actually, this one's true, had a $500,000 malpractice settlement against him from some sort of, botched hair transplant. He's had 4 more malpractice suits in the past 5 years. Like, that's insane.
How many malpractice things do you have to have before you get your license
That's a
taken
great
away?
question.
Or all of it.
To me, like if you have a full career, like you might see like one malpractice suit. It just depends on where you are too a little bit. Like some states are more protective of doctors and malpractice suits are not as common. But like realistically, like maybe one a career.
He's got a whole resume of it.
Yeah, he's got like 4 and 5 years. Since I've been in private practice for 15 years, I've had 0.
Okay.
Which is good. That's what it should be. If I got one against me, who knows if they're legit, right? If it's just one, it may be a patient just unhappy or whatever. It doesn't mean that.
So if somebody's looking for plastic surgery, can they look up if their doctors had malpractice?
I think that is reported to the state board because I think you have to report that if you have a judgment against you. Yeah.
But he doesn't have a board.
The medical board.
Okay.
There's a difference between the medical board and then like board
surgery.
certification. That's 2 different things. Yeah.
Okay.
The medical
So you
board,
can look
I think,
that up.
and that varies by state to state, but I think you can look it up. But also in addition to that, he's had 4 complaints against him to the Washington Medical Board in the past year. That's insane. Now, medical board complaints can come more frequently. I've had, I think, 2 against me, and both were just patients that were unhappy. One was a patient I didn't even see. It was like somebody that came to the med spa side, and it was for nothing. Another was a patient that had surgery and just, her outcome was fine. She just didn't like it, and she reported me. Both of those got looked at, and they were dismissed.
Yeah.
So the fact that, you have one doesn't necessarily mean that anything happens. Most of the time they get dismissed. But 4 complaints in a year, that's a little concerning.
A bad Yelp review is one thing, but
Right, 4 complaints. Yeah. One of the worst things, this is again allegation, letting non-medical office employees amputate penises. Yeah.
Whoa.
That's kind of crazy if that's true. Letting someone who's not a surgeon do something like an amputation is crazy. He also has allegations of sexual misconduct. This guy.
Next you're going to say he cheated on his wife.
Well, it's sexual misconduct. that's that pretty much sums it up. So again, these are allegations. Some of them have actually been happened. Some of them malpractice, DUI stuff. If it's 1 or 2 things, you can be like, well, it's just like me. I've had complaints against me to the Texas Medical Board that were absolutely nothing. They were dismissed. I've never had anything come against me that stuck, right? That they're like, yeah, the medical board side did something wrong. Because it's just like anything, like if patients have, when you see tons of patients, you can get someone that's unhappy and they're like, oh, I'm going to make a complaint. But 4 in 1 year is insane. Like, I think I've had 2 in 15 years, which were both dismissed. So that's pretty wild. The 4 malpractice suits in 5 years is absolutely insane. That's crazy. And one of the things the article went on to do was actually pull a research study that I didn't even know existed. I was actually pretty wild to see this, that the surgeons that are certified by the Cosmetic Surgery Board are 3 times more likely to have board discipline actions versus plastic surgeons certified by the Plastic Surgery Board. That's pretty crazy. That's a huge, huge number. That means that these guys are much more likely to be doing things that are considered, out of the standard of care.
So is this guy in jail?
No, he's not in jail.
That picture that you put up looked like he was wearing.
Get arrested. He got arrested for DUI, but he got out and.
That picture for some reason looked like he was wearing
Oh no! He's just wearing scrubs.
It looked like he was wearing. It looks like he should be in jail. He looks shady.
It looks like a show on not Lifetime.
Yeah, behind bars.
There's actually that's probably one of the better pictures of this guy, if I'm being honest.
He looks pretty shady.
Some of the pictures in the article were pretty rough. I felt like they were not necessarily being kind to this guy. But again, allegations. We'll see what happens. My take home from this is that people who skirt the system and try to do plastic surgery by getting either fake training or fake boards, you should be alarmed by that.
It sounds like a DIY plastic surgeon.
Yeah, kind of. But this is prevalent. It happens all the time because the laws do not protect patients. Anyone can call themselves a cosmetic surgeon. A family practice doctor who's never held a scalpel can call himself a cosmetic surgeon, and nobody will do anything. No one will do anything. Not until they make a mistake. And then, even then, it's like they get like a million chances, like this guy, and they just keep going and they keep going. So, I've been talking about this for years, about these fake cosmetic surgeons. You just have to be aware. Cosmetics,
he's going to keep going until he kills somebody.
Potentially. He had some really bad outcomes, allegedly. The article was super long. You guys should check it out. It's pages and pages. But we'll see what happens. I'll kind of keep an eye on this guy and see if anything happens. But all right, let me recap. I've talked so many times about fake plastic surgeons. They actually call themselves cosmetic surgeons because they can't, by law, call themselves plastic surgeons. And why do I say they're fake? Well, to be a plastic surgeon and do aesthetic surgery, you have to do a specially certified training program in plastic surgery, and then ideally get a board certification by the American Board of Plastic Surgery. But anyone, even a family practice doctor or radiologist, can legally call themselves a cosmetic surgeon. There is nothing that says that they can't do that. And in addition, if you go and you do even a weekend long or a month long course, there are fake boards out there that will certify you, and then you can say you are a board certified cosmetic surgeon, but in reality you haven't done even close to the amount of training that is required to be a full, safe plastic surgeon. And a recent news article talked about a Dr. Stiller out in Washington that's had a bunch of alleged issues pop up, and the article actually pointed out these specifics, that he's not a plastic surgeon, he's a cosmetic surgeon, and the potential issues with someone like that doing surgery. And I found that interesting because I've been talking about this for years, and now it almost seems like the media is kind of catching up. And it's hard because patients don't know the difference between a cosmetic surgeon and a plastic surgeon. They don't know the difference between a legit board like the American Board of Plastic Surgery and the Board of Cosmetic Surgery. So that's why I keep talking about it. I'm glad to see the news is catching up. Okay, good first episode in the new studio.
Yeah.
Right? Yeah? It's a good one.
And it's not raining yet.
It's not raining. I love the view. I can't wait to see the view. We'll have to studio shop, Sarah, and see if we like a different studio better.
Yeah.
I do like the talk show one. That's always fun. But okay,
very big.
That about wraps it up for this week. Thank you guys so much for tuning in. We really, really do appreciate it. Please hit that like, subscribe button, and leave us a comment if you have something we'd like to talk about on the next episode of Nip Talk. Bye.